What's up, everybody? Welcome back to our YouTube channel. This is Parents Magazine, and today we have a segment called Ask the Expert. Today is 1st of December, where we celebrate World AIDS Day, and today with us is Blench Wanjiku, who is a Treatment Adherence Officer from Kijabe Hospital. In other words, she's an expert in matters AIDS and HIV. Stick with us.
I'm Blench Wanjiku. I work in Kijabe Hospital as an adherence officer for Treatment Adherence Services Department. So I deal with HIV patients one-on-one. And I started this job 2004 August when we started this free ARVs. Yeah, that's the time in our hospital we started giving patients free ARVs. So, but before that, I had worked for 10 years in outpatient department. So the reason why I chose this department because I had a passion to work with these patients, because the doctor who was dealing with these patients, I'm the one who was only assisting him when doing procedures, when counseling patients. So I think he saw something in me. So he said, I want to work with Blench in this department. Now it came a time he was to go back to America. So another one came. So he introduced me to the new doctor. So we worked together and we started this project in 2004 August. In December, I went for VCT training so that I can be testing them at home or in the community. So I started to test them in 2005, going home to home, where you have had there's a patient who is sick. So I had to go and do counseling. So I was bringing them into the project from home. So by the time 2005 was ending, I had so many patients, but I knew them before we started the program because some of them were buying drugs, ARVs, and they were very expensive. So we were worried about them because they didn't have cash to buy. So many of them died that time. Before we started the program, most of them died because they didn't have money to buy drugs. We had them in our institution, but you couldn't get without buying. But from 2004, we started giving them the free drugs. So those who are sick at home, we managed to go for them and we started giving them the ARVs. And up to now, right, most of them are alive who adhered to the drugs. Right now, my work is to do counseling. Most of the times, when I test them at home, I just enroll them in the program. My work is to deal with them one-on-one, to do counseling, because you have to do counseling because of these drugs. They are not used to them. They are newly enrolled. Some of them are sick. Some of them have stigma, denial. So you have to sit down with them. And right now, many of them even can't notice whether they have HIV because they are adherent. And we keep on giving them TCS or clinic. They have to come. Those who are stable, they can't come every month. We give them drugs for 3 months. Yeah, those who are stable. There are those who are newly enrolled. They have to come for the first visit. They have to come after 2 weeks. After that, monthly. After 3 months, we do what we call viral load to check whether they are adherent. That one, viral load give us the answer. Even if you cheat, you are taking drugs correctly, viral load will tell us. Yeah, will tell us. And after that, they come after maybe, okay, those who are new enrolled, you can't give them wrong disease because you want to do follow-up. And after enrolling them, I work in the community most of the time, but there are some days I'm in the clinic. In our department, we are 4. So there are the days that you are in the community, there are the days you are in the clinic. In home visit, we do follow-up counseling. We do PNS, that means partner notification. You have to go and test the partners. And the family, the whole family, even children who are below 15 years, you have to test them. When they are positive, you have to bring them to the clinic, you enroll them, then you continue the journey. Let me say that now, many of them, they don't have denial, stigma. They are working like any other person. You can't notice anything because they are adherent to their drugs. But there are those very few of them, they devote. After they take drugs and see that they are well, some of them, if you don't follow them, you follow them at home. In fact, they will default. After defaulting, they start becoming sick because there are those opportunistic infections. If you started drugs, then you have devoted, you will have opportunistic infections like TB, meningitis, the major diseases. So we do follow up at home. That's why we have a department, the community department. We have another department called PMTCT department. They deal with pregnant mothers or postnatal mothers. They are positive, so we do follow up because we want their children to be negative. And right now, let me tell you, in our hospital or in our institution, it's very rare to get a child who is positive and the mother is in the hospital, because we do the follow-up. When you test a mother, she's positive, that day you have to start drugs, ARVs. You work with the mother, when the mother is almost to deliver, maybe 2 months prior delivery, we give ARVs for the child. Yeah, we have these drugs called nevirapine and Kijabe. After delivery, 72 hours, they stay with the drugs at home. When they go to the hospital, they have to carry the drugs. They give after 72 hours. We have that time we have counseled them how they will give the drugs, how they will be adherent, because we don't want the child to be infected. And we do viral load for them to see whether their viral load are high, because if the viral load is high, it is risky because she can infect the child. But they are very keen. Right now, below 5 years, we have around 5 children, and those they are the children who came positive, not from our Hospital. They came positive. Right now, I have a case of another mother. She devoted. Later, she got married. She refused to take drugs. Kabisa. She infected the child. The child right now is 3 years. Right now, as we are talking, she's postnatal 7 weeks. She has another child. Right now, I'm going weekly to do follow-up because of these drugs. She has these 3 years, she's taking her drugs. The newborn is taking drugs. She's taking her drugs, but the husband refused to come to our hospital to be enrolled, but he's positive. He refused. So every week I have to go there because I don't want her to have 2 children who are taking drugs. Okay. Now it is follow-up counseling. When I go for home visit, I tell her, bring all your drugs for the newborn and for the other one and for her. And because I have to count the drugs, because I know the last is this year, when she came last, I have to count the drugs to see whether she's taking correctly or sometimes she's forgetting, but no assistance from the husband. When he see me, he go out because he doesn't want him to be counted in that family that he's positive. But every day he tells me I will come. He has refused kabisa. But I'm dealing with the parents because they know they are positive, all of them. But I won't get tired. I have to go there every week to see how they are. They are going.
Okay, let me just take you back to Dongo.
Yeah.
I'm imagining in 2004 there was so much stigma around HIV and AIDS. Mm-hmm. Why was it important for you to take up that role as an activist or as an expert in teaching the community about the disease?
We have taught them, they know about the stigma. Okay, most of them, they don't have the stigma. It is all, some of them, not a big number, a small number. The others are okay. Even when you go for home visit, they don't have any problem. Even they have disclosed to the family. Yeah, they have disclosed. It's only, okay, if the husband can agree to come to be enrolled, the stigma will go. But right now, there's stigma because the husband has refused. Yeah.
Okay.
Yeah.
Okay. Again, when you talk about HIV and AIDS, I understand that HIV is a virus and AIDS is a disease.
Yeah.
Can you talk to us about that?
Okay. HIV, there's a difference between HIV and AIDS. HIV is the virus that is in the blood. That time, the patient doesn't have any symptom. But AIDS is the time the patient has refused to take drugs early. Now the patient has waited until opportunistic infections has started to appear. That's when the patient has gone to this class of AIDS. So when a patient has HIV, you can't notice. When the patient is in stage 1, stage 2, you can't notice. But stage 3 is the time the diseases started to come, like TB, cryptococcal meningitis, oral thrush. You can see the patient has oral thrush. That's the time that stage has started to come. That's when you say the patient has AIDS. Stage 4 is the time that the patient is bedridden. The patient cannot walk. The patient has diarrhea, vomiting. All the diseases are there. That's when the patient has AIDS. Okay. We stay with patient who has HIV, but you can't notice. And this is the very dangerous stage because it is the time they infect others. because you can't know who is positive and who is not. And that's why we usually say when we are doing HIV counseling to negative patients, we usually tell them, when you have a partner who is not tested, make sure you get tested together, you see the results with your naked eyes, or you use protection, because you cannot notice. Another thing, those patients who have taken drugs very well, you can't notice whether they are positive or not, unless one tells you, I'm HIV positive. Right now, we have another drug which was introduced like 4 years ago called PrEP. PrEP, it is for those patients who are negative to protect themselves from infection from their partners. We have something we call discordant couples. Discordant couples means one is positive, the other one is negative. The one who is negative has to use PrEP. When you use this drug PrEP, you cannot get infected. You can't, unless the partner has refused to take drugs. That's when you can get it. But if your partner is taking drugs clearly or correctly, you cannot get HIV.
Okay. Is it possible to have HIV maybe for the rest of your life and never get AIDS?
No, after you stay for many years, AIDS must come. Yeah, you have to get AIDS. That's the time, even it is impossible for you to go back to stage 1. Because maybe if you're in stage 4, you can't make it. You have cryptococcal meningitis, so many diseases, major diseases. That's when you hear everybody saying, Franny is HIV positive, because you have all the symptoms. Yeah, and that's why we don't sleep, because we want those who are positive to adhere to their drugs. And these drugs, in fact, right now they are taking only one tablet. One tablet have 3 drugs in it. Because there was a time, those years I'm telling you, we started this program, they were taking drugs separately, but right now it's only one drug, TLD. It has 3 drugs. So when the patient take one drug in the morning, nothing else. Because right now they are taking in the morning.
Or daily, on a daily basis.
Yeah, daily basis. And there are those who have devoted. We give them second class, because they refuse to take the first class. They are in second line. Second line, you can't go back to first line. That's why we do counseling. And in you do counseling, they say, I can't chase my wife away because she's positive. We are going to stay together. But after some time, you hear the patient is telling you, or the partner is telling you, that I'm not going to use PrEP for life, and I'm negative. She quit. That's the challenge we have with discordant couples. Yeah.
So I know that in the past there was stigma, and there were myths and misconceptions about AIDS. So currently, what are some of the biggest myths and misconceptions that you've had about HIV and AIDS?
In the past, so many people were saying it's a curse. But right now, they have come to know that HIV comes from when you have sex with positive patient or positive partner, or you don't have protection when you are nursing a HIV patient. Like if the patient has a wound and you have an open wound, you yourself who is taking care of the patient, you will get AIDS. But we educate them how to use protection, like gloves, if you have such a patient. But nowadays, we don't have bedridden patient in their home, at home, because they have agreed to take drugs, unless the patient has revolted. Or the patient has refused kabisa to take the drugs. Kabisa. Like tomorrow I have 2 couples, I'll go to test. Discordant couple. No, I can't say they are discordant couple because the partner, one partner is positive, the other one is not tested. Last week, but one I tested another one. She has married a girl, a very young girl, 19 years old, and the girl is positive, and he himself, I tested him, he was negative. So, kumaanisha, the one who is positive, she's taking her drugs very well and very correct. Tomorrow I have to. So, there's a possibility they can be positive, they can be negative. Because of this thing I'm telling you, U is equal to U. Undetectable is equal to untransmittable. So you cannot transmit HIV to anybody if you are taking drugs very well. Yeah.
That's interesting.
And another thing I wanted to tell you is that those youths who are positive, we usually hold their meetings monthly because of ongoing counseling. We educate them. We partner with the community. Like these partners are overseas. We partner with them so that they can help these children. When we have those events, they give us food. They give us many things to give them. Like girls, they are given pads. Some are given food. To carry home. Those who are vulnerable. So we partner with the community.
So I'm thinking about a case where the child is positive and it's a very young baby. So I'm assuming that when they are of that tender age, they're not aware of what is happening to their bodies. So what is the process that you guys take to ensure that they learn about AIDS and that they start now administering ARVs to themselves?
Okay, when you have these children, when the child is 7 years, we initiate disclosure to them. We initiate disclosure. When the child is 10 years, we disclose the status. Because this child was born with HIV, you have to tell the child where he or she got HIV. And we accompany the guardian. So many patients, children, they don't have their parents. They died. Some of them died. They are with their grandmothers or relatives. So we work together for those years until the child is 10 years. We disclose. We stay with the child until 11 years. When the child is 10 to 12, the full disclosure is done. When the child is 13 years, we switch the child to OTZ group, youth group. They interact with the youth now. But this youth, from 13 years, we have groups. You cannot take the child who is 13 years with the 17 years or 19 years. We have the groups because we have to educate them. But these below 13, they come with their guardians monthly, once in a month, for counseling to the guardians. We call it PAMA group. And they have to come, if the child has father, mother, they come together to the clinic that day. They take their drugs that day on a Saturday. Sometimes, most of the times, we tell them to come on Saturday because of school. We don't want them to lose classes. Like now they have crossed, we can call them during the day, during any day in the week. But when they are in school, we call them on Saturdays. That's why we have this advocate, youth advocate, so that she deals with they deal with youth. Yeah.
So in your career journey, what would you say has been the most devastating case that you have handled? What would you say has been the most devastating case for you? Like, ni kesi gani imeku affect sana as a healthcare giver?
The case that has affected me is like this one I'm telling you, for this mother who refused to take drugs and she infected her child. Actually, I was going every day when she delivered this child to take her to clinic because she had devoted. She refused. Kabisa. Yeah, she had a need. Kabisa. Because this child, it is not her fault to have HIV. It is the mother, and she knew everything. Because where she went to deliver, that's where she went. I tried my level best to go for ARVs for the child. She left ARVs in that hospital. I followed her at home to take her to our institution. She refused. Kabisa. Yeah. Even this time, she came because she was very sick. That's when she agreed to bring this child to clinic because the child was to die. After that, she conceived to another. When she confused, it was my job to go to do home visit. We call it DOT. To go and talk to her. But right now, she's giving that child, newborn, drugs very well. But when I go there, I see that child. It hurts me.
Yeah.
Because
it will have been prevented.
Yeah. Because when we started this program 205, I enrolled a family of 6. And right now, all of them are alive. The boy who was big, right now he has a wife with 3 children. The girl who was 5 years old, she has 2 children. The other boy has newly married. We are expecting a child soon. But they were so good. I was going, in a week I could go for 3 days because all of them had TB. They were very sick. I was getting a vehicle from the hospital. I was going for them because they could not walk. Right now, if you see them, you can't notice that they are positive. So I'm very happy with that family. Yeah, it's only one child who turned negative in that family. So I had mother, father, and 4 children.
Do you think, in your opinion, that the government is doing everything it can to educate the community about the disease?
Yeah, because even they have enrolled community of workers, even those who belong to us, some of them are taken with the government because they want to educate the community. Because if the community is educated, we are going to eliminate HIV. Like what we have done, we are eliminating mother to child transmission right now. Because you have seen, we have in our hospital, we have not more than 5 who are below 5 years. So we are eliminating. That's what we want. Even these drugs, they are bringing, like isoprep. And in fact, they are going to be they are going to help so many people, because if you have sex with a partner who is positive, you are not going to get HIV, and there is no worry because you will be negative if you are there to the doctors. Yeah, counseling. Yeah.
So let's talk about you as an individual, as Blench. What is that one thing that you have learned about this disease that has stuck with you? What is the biggest lesson that you have learned about HIV and AIDS?
Okay, what I have learned is many things, because in the past we were not educated, but right now we are educated about HIV, about transmission. Like right now we are happy because those discordant couple, in fact they were not staying together. They were divorcing because they knew that if my partner is positive, she or he is going to infect me. But right now, we have PrEP. Yeah, we have PrEP. We have this other one. We do PrEP. Yeah, people will not get infected. That's I am happy about it. Yeah, because they are educating us. Yeah.
So, okay.
I've had so much and I've learned so much. I'm so excited the fact that you're working with young people, and I'd love to know your interaction with the young people since you've been here since how long has it been since you've been doing it?
From 2004.
From 2004.
Yeah.
And then I've had you mention the fact that you have young people who go to the community to educate the people about the disease.
Yeah.
How do you interact with the young people and how do you teach them? And how do you also impact them, the young people with the disease? Yeah.
Okay. Concerning young people, we educate them to get tested. To get tested so that you can know your partner whether she or he is positive. Even I am very happy when I interact with youth because so many of them, if they are there, what you are telling them, they don't get infected. Because, like this one I'm going to test tomorrow, it's a young man, but when they started the relationship, the lady didn't disclose to him. He became to know that the partner is positive when the girl went away and she went in the box. Yeah. He had a spirit. There's something here which is hidden. He got drugs. When he got drugs, he Googled. And he saw ARVs. He was worried. When I went home this last week, he was telling me, I want to be tested because she didn't tell me. But if we had educated him or counseling him, he couldn't go to that one before they get tested. So to me, to use, we tell them to get tested before. Don't rush to the relationship if you don't know whether your partner or your partner is positive or negative. Yeah. Or use protection. Use protection.
Wow. And how do you interact with the youth leaders that you work with? You stated who work from 12 years plus. How do you teach them to go ahead and tell the others and give the information out there, especially to the young people, that this is disease goes this way? It's about HIV AIDS, that is rather.
Yeah, we call those who have taken their drugs very well. Even there are some we give them a token every month.
Okay.
They go and interact with those youths in the community. Yeah. If there is an event somewhere, they go and educate them. Yeah.
Wow. You say, what are they called? What are they called, those leaders who go ahead and give the information out there from your hospital? The people that you work with, that is, the young people.
We call them AYP.
Yes,
AYP advocates. Yeah.
Dennis.
So I'd love to hear your parting shots and what you want the world to know as your closing remarks for this interview. So you're going to look at this camera and address everybody who is watching you right now in regards to HIV and AIDS, and also tell us something about the World AIDS Day.
Okay, the World AIDS Day, it helps us, we as staff or those people who are working with this program. Like Friday, we have some events in the community. Like in our county, I heard it will be at Kirigiti. So we go there. we mobilize people, we educate people in that area and everywhere we are. Like in the past, we used to have events in our like Kijabe, we used to have events. We call all our patients to come together. We eat together, we educate them, and they were very happy. Right now, it will be at Kirigiti, and we have to go. So the whole community will know it is AIDS Day, and we are going to educate them how they are going to prevent themselves from getting HIV. Because when you get HIV, it is forever. You'll take drugs forever or ARVs forever. So we educate them how they are going to prevent themselves from getting HIV. Yeah.
What would you like to tell clients? As an expert, what would your advice be to people? Maybe those who are negative and those who are not negative.
Okay, for those who are positive, I can encourage them to come to go to the nearest hospitals where they give ARVs. They take their ARVs and they will continue with their life forever. Those who are negative or those who are not tested, to get tested. Because the area you know your HIV status, you know how to get how to prevent yourself from getting HIV. Yeah. And I can tell them not worry about going to be tested, because even us staff, we get tested so many times because we want to know our HIV status. Yeah, and we have drugs. You know, like diabetes, we don't have drugs, free drugs. Right now, HIV, we have free drugs. They don't pay anything. When the patient comes to our institution, they don't pay even a single cent, and they get drugs every month. Every month. Yeah. Even we don't charge for HIV test. It is free. So I can tell those who are negative to stay negative. Those who are positive to take the ARVs. To have longer life. Because if they don't take ARVs, they are going to have opportunistic infection and they will die. Yeah.
Is there anything else that you want to add?
What I can add is to encourage every Kenyan to support those people who are positive, not to give them stigma, to make them their brothers and sisters, because it is they didn't apply like how we apply for a job to get this HIV. Most of them, they didn't know whether they were infected. So to make them brothers and sisters and to support them and to support those children who are vulnerable. Their parents died. They are with their grandmothers or their relatives, and maybe they don't have support. We support those children, or vulnerable children, and those children who are HIV positive. You know, there's vulnerable children, but they are not HIV positive. We have this class, children living with HIV. They need support from everyone, from every Kenyan. Yeah.
I hope you learned something from Blench, because I know I did. We can, we must, and we have to end AIDS, because AIDS takes a life every minute. And that is the theme for this year's World AIDS Day. That marks the end of our show today. See you on the next one. My name is Njambi Gaitho.